Members, here we are in our part one of education policy meeting today. Our first order of business will be to approve the minutes from our last meeting, which was Tuesday, March 12th. And Representative Berg, have you had a moment to review the minutes, and would you motion for the approval?
Yes, Madam Chair. I was just looking them over, and I move the approval of the minutes.
Thank you. Any discussion on the minutes from March 12th? All right, hearing none. All in favor of approving the minutes, please say aye. Aye. Opposed? All right. The minutes are approved. Thank you. Well, we have a number of bills that we'll be hearing today and discussing. There's the bills that we heard the testimony from yesterday and that we're going to continue the discussion of. But I think we'll start with the new bills right now, and then at the end of this session, return to the bills from yesterday for discussion. And we have first up, House File 3682, Representative Kotyza-Witthuhn as our chief author of this bill. You're not currently a member of this committee, though you have been in the past, Representative Kotyza-Witthuhn. So I think I will have, if Representative Berg, if you would move also House File 3682 to be before us.
Thank you, Madam Chair. I move House File 3682 to be before the committee.
Thank you, Representative Berg. And I believe there's also an author's amendment
That's
for
correct,
this.
Madam Chair.
Right, so it's the A4 amendment. Just briefly, would you describe how this A4 amendment changes the bill?
Certainly. Thank you, Madam Chair. So the A4 amendment gets the bill into the shape I would like after some additional feedback from the Department of Education and the Minnesota Youth Council.
Thank you, Representative. Representative Berg, would you also motion the A4 amendment before us for approval?
I'm sorry, Madam Chair.
It's
I move
the
the
A4
A4 for approval.
Thank you. All right, any discussion to the A4 amendment before we discuss the bill? All right, all in favor of the A4 amendment, please say aye. Aye. Opposed? Thank you, members. All right, the 3682 as amended with the A4. So Representative Kotyza-Witthuhn, please introduce your bill.
Thank you, Madam Chair and members. I'm proud to be carrying House File 3682, a bill that would standardize health education across our state. I would like to give just a brief introduction to the bill, and then I will ask House Counsel to walk through the specifics of the language. But members, as we know, in today's changing world, our children have more exposure to technology and all the things that come with it than ever before. So this access and exposure can create a variety of challenges for them as they grow and learn. House File 3682 will standardize health education across the state, which is a crucial step in ensuring that all students, regardless of their location, receive a consistent education related not only to their own health, but also the well-being of their family, friends, and their community. This bill utilizes the rulemaking process, allowing for any and all interested parties to engage the Department of Education in this process. Currently, health education is the only required subject matter in Minnesota that is not standardized. Rulemaking allows for a transparent process that will require the input and buy-in of a variety of stakeholders. These stakeholders are then compiled into a standards committee, which participates in this process. This includes parents of school-aged children, teachers and faculty throughout the state, school board members, members of our tribal nations, and now students with input from the Minnesota Youth Council. After this standards committee completes their recommendations, there is ample opportunity for public comment and consideration. Minnesota statute related to this matter specifically stipulates that the standards created are clear and objective and do not require a certain teaching methodology. Simply put, the process of rulemaking and crafting this bill and carrying it toward eventual implementation is a process that's objective and relies on important checks and balances while being open to the public at key junctures. So, Madam Chair, if Ms. Pryor would walk through the specifics of the bill, and then we can move to testimony.
Thank you, Representative Kotyza-Witthuhn. Ms. Pryor.
Madam Chair and members, Christina Pryor from House Research. The bill, the first several sections of the bill modify the language related to standards generally, adding health to the list of state standards and removing it from, well, it's currently the only local standard. So for example, in section 1, number 2 of the list is struck there and health is added to the state standards. In section 2, line 2.4, it's also striking the locally developed requirement for health standards. But there's a paragraph there at the end of the section adding that the locally developed standards would continue to apply until either the end of the 25-26 school year or until the commissioner adopts the statewide rules implementing the state health standards, whichever occurs later. Section 3, again, adding health to the list of the state standards. That's the section that talks about the groups that the commissioner considers advice from. And in the amendment that you have before you, there is an added line, a new number 7 at the end of that list, that would require the commissioner to seek input from current students and the Minnesota Youth Council. Section 4 is the rulemaking statute, the rulemaking provision, and this would require the commissioner to adopt statewide rules for the state, for the health standards. Section 5, this is the provision that says that the standards are all reviewed on a 10-year cycle. So it's adding the health standards to that 10-year cycle in the new paragraph H on line 512. Section 6. This section of statute lists the credits that students need to complete to graduate from high school. And so you'll see there, for example, they need 3 credits of math, et cetera. This adds credits sufficient to satisfy the health standards, so it doesn't enumerate how many credits would be necessary. It says sufficient to satisfy the standards, which is similar to what is in the requirements for physical education in number 6. Section 7, so this in the amendment that's before you, this section is deleted and is instead, replaced by a codified section. So that's what's in the amendment before you, starting on line 1.7, the health education standards. And subdivision 1 requires the commissioner to begin the rulemaking process to adopt the standards. And then requires the rules to include at least the expectations for student learning that are in subdivision 2, and then may include the expectations in subdivision 3. So to go through those in subdivision 2, these are requirements that are currently in statute. For example, CPR and automatic external defibrillator education. That's currently in 120B 236. So that's instruction that districts are currently required to provide. So number 1 through 5, those are all currently in statute. Number 5 is mental health education. That's currently an encouragement in statute, but in this bill, it is in the required subject areas. And then subdivision 3 are subject areas that the commissioner may include in the standards, and these are all, the current statutes encourage districts to provide that instruction. For example, character development education or child sexual abuse prevention education. Then section 8 of the bill is a blank appropriation to the department to complete the rulemaking. And Madam Chair, members, that's the bill.
Thank you. Thank you, Ms. Kerr, for walking us through that. We appreciate that. It's complicated. It is. Thank you. And I believe now we have testifiers, and that they're all in person. And I have first up Jeanette Jimenez, an intern with the Women's Foundation of Minnesota. And then also after that, it will be Koji Del Rosario from Minnesota Coalition Against Sexual Assault. So if you can be ready. You can introduce yourself and begin with your testimony.
Honorable members of the committee, for the record, my name is Janet Jimenez, and I am a fellow and program manager at the Women's Foundation of Minnesota. Thank you for the chance to testify today in support for House File 3682, which will represent a pivotal step forward towards ensuring students across the state of Minnesota to get an opportunity to learn what they need to grow up safe, healthy, and confident. As mentioned, the current health education standards are not set across the state level, which means that depending on where you live in Minnesota, this will determine what students learn about essential topics such as violence prevention, substance abuse, mental health, and reproductive health. The essence of House File 3682 lies in the commitments of the well-being of young people and providing them with the necessary tools to make informed decisions with positive impacts in their lives and the lives of their peers. The knowledge shared in classrooms has value for their lives long after school is over. By passing this bill, we will not only safeguard the well-being of young people, but also foster a society that values all people. It is imperative to recognize that young people are at risk of continued health hazards such as disease, psychological stressors, substance misuse, violence, and more without these standards. A holistic health education approach is essential to preventing harm and catering safer, more equitable, and thriving communities across the state. The repercussions of inaction are far-reaching and can perpetuate cycles of poor diet habits within students, lack of exercise awareness, unawareness of common mental health conditions such as anxiety, depression, and stress, and coping mechanisms to combat these things. Health disparities also are a big impact within the approach of the health standards because not everyone has access to a health education within their homes, and it would be easier if they can get access to this in schools. As a part of my role at the foundation, I work with a youth group and focus on policies that relate to their everyday lives. And from these youth, I have also learned that there is a need for a statewide health support for their ability to grow and learn with healthy lives. As a representative of the people, you have the moral obligation to ensure that every individual in the state of Minnesota has access to proper health and helps them, which will help them live a healthy life, a more safe life, and a confident life. We urge you to pass this proposal to ensure students in Minnesota to have access to education on health subjects and will allow them to live a fully and healthy lives. Thank you for your time and your consideration.
Thank you for your testimony. Next up, we have from the Minnesota Coalition Against Sexual Assault, Koji Del Rosario. If you can introduce yourself and proceed.
Good afternoon, Chair Pryor and members of the committee. My name is Pogi Del Rosario, and I'm one of the prevention program coordinators at the Minnesota Coalition Against Sexual Assault, or MINCASA. MINCASA's vision is that of a world free of sexual violence, in which all human beings are treated with dignity and respect, and communities are transformed through safety, healing, and partnerships. Our vision is directly in line with the contents of this bill, and today we are demonstrating support for House File 3682. We want youth across the state of Minnesota to have access to education that provides the knowledge and skills to make informed decisions that will positively impact them throughout their lifespan. MINCASA has convened over 100 Minnesotans committed to this cause. The Health and Wellbeing Education Standards Work Group is comprised of advocates, health educators, students, parents, and community members. This coalition of Minnesotans seeks to take actionable steps toward ensuring that all young people are equipped with the means to attain their highest levels of health. This work group includes both health experts and those who would be most impacted by those standards, students. It is imperative to listen to and uplift these voices and their experiences. MINCASA is dedicated to the primary prevention of violence. Primary prevention is taking steps to stop violence before it can occur. The implementation of such health standards would build foundational skills in effective communication, character development, and teachings of consent. These core strategies of primary prevention aim to eliminate risk factors and promote protective factors for Minnesotans. This bill would facilitate collective community efforts to prevent harm and center positive health outcomes. To fulfill a vision of a world free from sexual violence, transformative change is necessary. House File 3682 provides the opportunity to make crucial health improvements for all Minnesotans. A holistic approach to health education is essential for preventing harm and creating safer and thriving communities across the state.
Thank you.
Thank you.
Thank you for your testimony. I have Dr. Sheldon Berkowitz from Children's Minnesota, and after that, I have from Minnesota Youth Council, Ayla, that's probably better, who will be on deck. Please proceed, Dr. Berkowitz.
Madam Chair and members, thank you for allowing me to speak today. My name is Dr. Sheldon Berkowitz. I'm a retired pediatrician and am the immediate past president of the Minnesota chapter of the American Academy of Pediatrics. Our chapter represents over 1,000 pediatricians in the state, many of whom are in the chamber today for Pediatricians Day at the Capitol. We advocate for the health, safety, and well-being of our patients, Minnesota's children. I'm here to testify in favor of House File 3682. This bill aims to improve the academic standards for Minnesota students to include elements necessary for a well-rounded health education. We are not doing a good job at preparing our children to live healthy, thriving lives. Kids today are facing multiple challenges to their mental and physical health, and the earlier we can teach them about how to take care of their own health, the better. In my over 35 years working as a pediatrician, with the last 20 at Children's Minnesota, I've seen increased rates of mental health concerns such as depression and anxiety among adolescents, higher rates of eating disorders, childhood obesity, and diseases such as type 2 diabetes among school-aged children, and increased rates of emotional and sexual abuse among youth of all ages. Additionally, Minnesota's kids need to be educated about how to live a healthy life in the year 2024 and beyond. In a world filled with access to vaping and cannabis products marketed towards children, where every kid has multiple social media accounts, and where any child who is old enough to type can expose themselves to all the information and open communication of the internet, we need to conscientiously do better by our kids. This bill would help ensure children and families from every corner of the state will receive consistent education related to their own health and that of their family and communities. On behalf of the state's pediatricians, I am grateful to Representative Kotyza-Witthuhn for bringing this bill forward, and I'd be happy to answer any questions. Thank you.
Thank you. All right, we have our testifier from the Minnesota Youth Council. If you can step forward. Actually, I think we have two testifiers if the second can be on deck. If you can introduce yourself and proceed.
Thank you, Chair and members of the committee. My name is Ayla Mackey-Brudd, and I am a representative on the Minnesota Youth Council, as well as an 11th grader at Twin Cities Academy High School. I'm here to speak on behalf of myself and all young people across Minnesota who are relying on our school system to educate us and prepare us for our futures. The purpose of quality education is to prepare young people for becoming active and successful members of society, as well as teaching skills for everyday life and wellness. School prepares us by teaching college preparatory skills and career skills, and by teaching us mathematics and reading and the sciences, and yet many young people have no idea how to take care of their own minds and bodies because curriculums lack fundamental health education. Currently, our schools are not meeting their purpose of supporting students in this way. Educating students about mental health gives them the power to identify when they need help and gives them the knowledge and resources to know how to address it and where to go. Many young people, including some teenagers that I am close with, have already had to talk several of their peers out of committing suicide. These situations demonstrate a significant problem in our system of education. Children should not be responsible for saving lives. Schools have an obligation to teach us what to do in a crisis, and more importantly, how to prevent the crisis from ever happening. Many young people do not have an understanding of how to get help if they are struggling with their mental health. Most of my peers have never known how to access therapy or counseling, and many of them don't know about the suicide hotline or how to use it. Sex education is not a mandatory class in many schools, and drug education is mandatory in even fewer. Without statewide education standards, not all of Minnesota students have access to equal support in these areas. Statewide health standards allow all students across the state to have equal access to curriculums and prevent any disparities. Making mental health a part of school curriculums forces people to talk about it and destigmatizes honest conversations surrounding mental illness, suicide, and self-harm. Required health curriculums will provide students with the knowledge and skills they need to have happier and healthier futures. And so I urge you all to please vote in support of House File 3682.
Thank you. Thank you for your testimony. And also from the Minnesota Youth Council, Adona? Nye? Maybe not? We appreciate that. Usually you don't see this many pediatricians in one room. Thank you for being with us today. I think we'll have to recognize you there. I did not have an appointment today. I really feel like I missed out. So you don't live in Minnetonka or Eden Prairie, okay? That's all right. Thank you for being here and for witnessing. All right, we have no more testifiers on our list, and we'll turn to member discussion. Representative Keeler.
Thank you, Chair. I just can't help myself sometimes to ask some questions. I love this bill. Two questions I have. We're starting on line 712. We talk about mental health, and I agree we absolutely need to talk about it. Can you just walk me through if that would include talking about the 988 access? I know that we put that on all of our student IDs. One of the things that I've learned as I've been in high schools is we're not actually talking about that resource very well in schools. Can you tell us if the mental health concept of this would include access to 988 and how to utilize that?
Representative Kotyza-Witthuhn.
Thank you, Madam Chair, and thank you, Representative Keeler, for bringing that up. I did make a note of that when our student testifier shared her concerns specifically about suicide. In the amendment, I just want to point out that we did shift, as Ms. Para had mentioned earlier, shift mental health from the encourage section of the standards that are currently in statute into the required for discussion. So we were saying mental health must be included in whatever is put forth throughout the rulemaking process. We don't have the 988 number specifically included in that at this point in time, but I'm open to adding that potentially in a parenthesis or something. But I know that as throughout the rulemaking process, that we're including that on student IDs and just making sure awareness is growing across the state. I'm sure that would be something that the experts would probably want to be included.
Mm-hmm. And as we heard the description as you described the rulemaking process, there is, the stakeholders coming and being brought intentionally forward to do a draft and then the public comment. And so we know that it's all up to all of us to watch the standards as they unfold and make sure that, that crucial piece of information would be added to it, even if it's not, listed specifically as part of the statute that introduces the rulemaking for health standards. It doesn't mean that somehow we're going to leave. I don't think that's possible to leave it out, but that would be my opinion. And I'm not an expert. Representative Keeler.
Thanks. Continue to plug that we have 988, I guess, is where it's at on record, legislative intent to make sure that we continue to talk about that with our kids. My next question, I'm not really sure where it lands with the amendment, but is around the sexual abuse and violence prevention. I just want to add that as we do the student breakdowns, one of the elements that I would hope that we would continue to talk about is sex and human trafficking. Signs of this, we're seeing that the student report is increasing in yes responses to have they engaged or interacted in in their communities, and actually the highest percent of yes is Northwest Minnesota. So just another legislative intent as we move forward in this conversation. I think talking about violence and sexual assault is really important, but adding the human trafficking piece on top of that. So for whatever that's worth, I really like the bill, good work. I just would like those two things noted in the record. Thank you.
Thank you, Representative Keeler. Representative Baker.
Thank you, Madam Chair. Thank you, Representative Kotyza-Witthuhn. It's a mouthful.
You got it right.
I have a little different perspective on this bill. I think as we sit and we listen to discussion, testimony. If I wasn't in a school, often I would think, well, there's nothing being done in our schools around these different topics. And nothing could be further from the truth. There is a ton of work around all of the topics outlined in the bill that school districts are working really hard on. And I think the disconnect for me in this bill really centers around local control, because the process of identifying how to address the different topics has really been worked on hard at the individual district level with student input from that school district, parent input from that school district. And as I go through the bill, I just have concerns about removing that local authority and that local autonomy. So line 1.11, we strike the provision for locally adopted expectations for learning health. Moving through 2.6, same thing. And then going into the standards and effective dates. Like, if we didn't learn anything in last session, we should learn that we have to be very cautious of our effective dates and the implementation of things, because that ties the hands of our districts. I would agree with Rep. Keeler about trafficking and human trafficking, about having conversations and warning signs. We need to have those conversations with our kids. 988 in my building, it's on the back of every kid's ID. It's in their student planner. We ordered fancy little stickers to do that. So districts are figuring this stuff out based off of the legislation that we passed that best fit their local communities. And I think as I went through, and it might be, my numbers might be off with the DE, but I counted 7 times that it says must in this bill. And I've said it before, I'm going to continue to say it. When we say must, what school districts hear is this is a mandate. And we at this table are telling our local school districts how to do this topic. And it's touchy. If you would like to come and spend a day with a principal or be involved in a conversation with a teacher who maybe didn't communicate the way that they should have, or a principal didn't communicate, it's not fun. And what we are doing right now is saying, local school board, you have no say in this. We're going to develop this at the state level, and we're going to get input, but the locally elected officials don't have a say. And I think the letter from the school board, from MSBA and the different groups, they really outline it well about what happens at the local level. Community engagement, number one, that fosters trust in the local community. The people that are elected to our local school boards, they're local community members. Diverse local needs. There are different needs, and through the process, those needs are heard, those needs are valued, and when you hear that, it builds trust. And then it's accountability and responsibility. If the local district gets something wrong, they are locally accountable. If someone from, Duluth, Minnesota, I don't think anyone's from Duluth here, has an issue, the constituents of Duluth don't have a voice over this bill at this committee table. Obviously, through the process they do, but not at this committee table. And so for that reason, we need to continue to support our local districts, local autonomy to be able to meet the needs. So thank you, and I just respectfully can't support this.
Chair Yuiking.
Thank you. Thank you, Chair Pryor, and thank you, Representative Kotyza-Witthuhn, for bringing this bill forward. Sometimes I know exactly what we're doing, and sometimes I get confused when other people talk, so I just want to clear things up. Is there anything in this bill that prohibits a local school board to add on to something on top of the standards? I know the standards process is a lengthy one. It can take up to 2 years. We actually, part of the standards is having teachers and local electeds at the table, or representatives from those groups, and the business community. It looks like in our underlying standards development process, it's parents of school age, I'm looking at subdivision 2 on lines 3.11. Parents of school age children must be part of the standards development. Teachers, administrators, members of local school boards and charter school boards throughout the state, faculty teaching corps, TNEC, which is important, business community, because, we educate the future workforce, totally get that. I'm glad that you're adding the Minnesota Youth Council, because I think that's what's been missing in some of the standards process until the last few years. So those folks are at the table with our experts, because as elected officials, I'd be worried about me telling people what they should learn in health, and they're going to develop that base standard for the graduation requirement we already have in place. Is there anything in here that says the school district can't add on top of that requirement?
Representative Kotyza-Witthuhn.
Madam Chair and Chair Joachim, no, districts certainly could go above and beyond what would be included at the end of the rulemaking process. And the standardizing a specific subject matter doesn't require certain teaching methodologies or styles. Local units would still be responsible for determining how their students do reach the destination of learning about mental health. And I think that, as we continue moving forward in the insight that we've heard from pediatricians and the students who came to the table, one of the great things I think about including the Minnesota Youth Council in this process is that the Minnesota Youth Council, contains students from each congressional district, across the state, and so the variety of insights that we're going to get from Greater Minnesota and the suburbs and the metro area, but then of course local districts would still be able to go beyond what is established.
Just one quick follow-up, Chair Pryor, is that okay? And it's more of a comment or a question. Do you want comments later or just now?
I think we'll,
Okay.
discussion is good.
Got it. So I just want to say, so folks know this, it's been a long day already, tonight's going to be rough, that we already require a half a credit to graduate in health. We have many other graduation requirements. Every single one of the other graduation requirements have standards set by the state. And then the district gets to pick the curriculum to teach to those standards. This is the last graduation requirement we have that is not set at the state level. And I understand that every community is unique, just like every one of our students are unique. And our unique students across the state have been asking to have something that is more concise and comprehensive, just a baseline. So when kids move from one district to another, they know what to expect to graduate. And this is just a baseline, and we're setting it through the rulemaking process and making sure that we have a base of standardized requirements for health. Some kids in one school district might be getting the CPR. Some kids in other school district might not be. Some kids in one school district are getting taught about mental health. Even though it's in our statute, doesn't mean it's getting taught there. And the standards process around graduation requirements are important, so we have that baseline that we can expect when those kids get that diploma, we have an idea of what they've learned. So I just want to thank you for putting this in, because health is huge. Health is a huge part of everybody's life. It sets you up for success or failure depending on how early you learn about all those things. I would just had the Kidney Foundation was in a few, last week already, and they were going through all the things that you need to do when you're younger so that your kidneys can stay healthy longer. And most of that I had never heard of. Part of that I was like, ooh, I think I already screwed that up. But it's just important for our kids to have all the information, beginning to have a healthy living later on. In fact, one last thing really funny, my husband listened to an amazing podcast by a doctor about, I think the book was called Outlive. I couldn't stop him. He bought one copy for each of our kids, because it's all about setting up your life to be successful, healthy-wise, physical activity-wise, longevity-wise, and it starts when you're young. So this is really important, so thank you.
Representative Bennett.
Thank you, Madam Chair. I'll start with a question if I could.
Yes.
Representative Kotyza-Witthuhn, just a quick question. So currently, we have all these areas, the standards are required to cover CPR, vaping, cannabis, and so on, the list here. Are there currently supports offered at the state level, such as model policy toolkits, guidance, state assistance for these areas? Do we know?
Ms. Pierre?
I don't mean by law, if I can interject. Are those there? I don't know if anybody from the departments here that.
Ms. Pierre?
Madam Chair, Representative Bennett, there are some state resources. The mental health statute, for example, has, I believe it's the Department of Education or perhaps Health, gathering some resources for districts. And I believe the Department of Health has some vaping prevention materials. The cannabis bill from last year required the Department of Education to develop a model program for substance use prevention. So those are the ones that come to mind, but there may be others.
Thank you.
Representative Bennett?
Thanks, Madam Chair. I should have asked the knowledgeable person. You're knowledgeable too, and to say, but with the laws. Thank you so much. I love having those two experts over there, don't you? So my thought is, and I'll just add some comments, that we're constantly, and it seems like more and more, mandating a state one-size-fits-all standards, models, whatever they are, onto our schools. Since we already have guidance, toolkits, model policy, why not beef those up? Give these general areas that need to be taught, which some of them already must be taught, and then let schools use that as a buffet of saying, okay, what best fits our community? Because as soon as we start to say everybody must meet it this way, this standard, and especially in this area where we merge into moral beliefs, religious beliefs, and all kinds of things like that that are different throughout our state, a little bit different than teaching math and whether we do, addition, subtraction, algebra, and all those things. This is an area that especially should be local control, where our parents, our school boards, and that local process dictates how they want to see these fleshed out in their own communities. And it concerns me greatly because we are going to set up our schools like this in communities and start a lot of struggles and stress that we don't need in our schools right now. So I understand the need for saying, we need to teach in these areas, but I don't understand the need for one size fits all, these standards must be developed. And quite honestly, with the rulemaking process that was spoken about here, I'm not sure if I trust that process anymore. I used to think it was pretty unbiased and standardized, but the more I see what happened with the social studies standards in particular, where pretty much half the state was left out, and it's a group of, as far as I know, mostly appointed people, and yes, they're experts, but it's more and more being used to, in my mind, kind of weaponized for political purposes or political things into our curriculum, and that should not happen here. So I have issues with rulemaking process, especially in areas like this that are very sensitive locally. This should be local control. So thank you.
Thank you. And I will turn to you, Representative Kotyza-Witthuhn, if you want to comment specifically or just begin your closing remarks.
Wonderful. Thank you, Madam Chair. And I so appreciate everybody's insight here today. I mean, I think that the start of this conversation is so important because as some of our colleagues have mentioned, we know that we're not the experts, right? And we have a principal here at the table. I've started having discussions with a variety of the different associations. Certainly I've met with Youth Prize and the Minnesota Youth Council directly. I've met with the Association of School Administrators and the elementary school and secondary school principals. We're still looking to schedule additional conversations just to gain insight, particularly from the local level and how our districts are handling the large amount of information that came at them in the last session. And in terms of timeline, I think that some of those conversations that we had, we know while it's in the language as after the end of the 25-26 school year or once the rulemaking process is is ended, whichever is later. So I think making sure that our districts do have time to adjust to what they're instituting now currently, but then going forward, and that we continue to engage them in these conversations. So I think that we do recognize that the students all across Minnesota, no matter where they live, no matter where their classroom is, that health education enables them to understand and make well-informed decisions, not only about their own life, but how to support others around them. And adding health to as the last one, the list of subject matters required to graduate for statewide standards can help us accomplish this. Thank you.
Thank you. And with that, members, we will now vote to move House File 40, got to go back, am I right? Yeah. Just a little bit. I got up on the wrong one. 3682. With that, Representative Berg renews her motion to re-refer House File 3682 as amended to the Education Finance Committee. All those in favor, please say aye. Aye. Opposed? No? No. All right. Thank you. The motion carries. And House File 3682 as amended is on its way to Education Finance. Thank you, Representative Kotyza-Witthuhn.
Thank you, Madam Chair and members, for the discussion today.
All right. And then we do have Representative Hassan is the next bill, and 4363. Thank you, audience members. Well, Representative Hassan, we started the discussion, I think, of the gist of what your bill is, and we'll see how this kind of works into our other discussion of health standards. So our next bill, members, is House File 4363, and it's our intention to hear the bill and lay it over for further consideration and possible inclusion in a policy bill. And Representative Frazier, can you please motion House File 4363 to be before us?
So moved, Madam Chair.
Thank you. And no amendment. All right. All right. So we have the bill before us. If you could, thank you, Representative Hassan, for returning to your committee, and and please proceed with your testimony.
Thank you, Madam Chair and members. This is a very simple bill. I'm going to say that, and I hope you guys don't make it complicated. It is a bill requiring it's a bill requiring mental health education to be included in the health education curriculum. Statute 120B-21 states that school districts and charter schools are encouraged to provide mental health instructions for students in grades 4 through 12 aligned with the local health standards and integrated into existing program curriculum or the general school environment of a district or charter school. And the only thing that we're changing is we're saying instead of encourage, mental health education must be included. And why do we need a bill like this? I'll give you some data. 42% of high school students in 2022 reported feeling sad or hopeless for at least 2 consecutive weeks in the previous year, that they stopped engaging in their usual activities. That's up from 26% in 2019. Girls and the LGBTQ plus young people particularly reported feeling those feelings more than others. Thoughts of suicide, suicide attempts, actual suicide among young people have also risen in that period, with Black children nearly 2 times more likely than their white peers to die by suicide, according to the U.S. Center for Disease Control and Prevention's biannual Youth Risk Behavior Survey and CDC stats. Depression and anxiety are among young people, Depression and anxiety, sorry guys, I've been presenting bills all day. Depression and anxiety among young people by some measures doubled since COVID. And still, those numbers are lingering. The American Psychology Association reported that we're facing national mental health crisis in our schools that could yield serious health and social consequences for years to come. And that Madam Chair, is why we have this bill. And this bill comes from a young intern who was working with me over the summer, came to me and said that I see this problem. She is, I believe she's in high school or a high school graduate. I think there's a video that we'll watch. And she said, I'm really worried about my peers. There's a lot of talks about anxiety and depression, more than what's common. And I at least know folks who are talking about suicide, or I hear about people who have attempted suicide or committed suicide. So what is our health standards when it comes to mental health? And I said, I don't know, let's look at it together. And we look at it, and we saw that it's encouraged. The word encourage doesn't mean that people have to do it. It's just that whoever wants to do it can do it. Whoever doesn't do it, there's no law that requires them to do that. So that is where this bill comes from, and I think it's befitting that we're just talking about health education standards. So I figured this will go well with including that in the health education reviews. And I believe, I don't know if we have a video from, we'll watch the video and we'll stand for questions.
This will be our testimony.
My name is Aisha Ibrahim. I'm a senior at Egan High School, and I'm an intern under Representative Huot on Hassan. I am testifying in support of House File 4363, a bill
You guys hear?
mandating mental
Sound
health
up?
education in the
Sound
state
is
of
low.
Minnesota. Why is mental
Get
health
the sound up.
important is a question that many people like to ask. As a student, juggling school, employment, and extracurricular activities can be a very hard task. Mental health is similar to physical health in that you need to know how to take care of yourself. School is the place that youth like me spend most. Hello, my name is Aisha Ibrahim.
Yeah.
Hello, my name is Aisha Ibrahim. I'm a senior at Egan High School, and I'm an intern under Representative Huot on Hassan. I am testifying in support of House File 4363, a bill mandating mental health education in the state of Minnesota. Why is mental health important is a question that many people like to ask. As a student, juggling school, employment, and extracurricular activities can be a very hard task. Mental health is similar to physical health in that you need to know how to take care of yourself. School is the place that youth like me spend most of their day in. It's a place where we deserve to feel as though we are supported, not only in our academics, but also mentally. Many mental illnesses are left untreated because people are not only uneducated about signs of mental illness, but there is a huge stigma surrounding mental health in our society. Students are suffering in silence because they don't know how to deal with their mental health issues or how to seek help. This bill mandating mental health education will allow for students to learn more about common mental health illnesses and increase the much-needed conversation about mental health. It will allow for teachers to better support students and will further make youth feel as though they are in a more supportive, inclusive environment. Legislators, I urge you to support HF 4363.
Thank you. Thank you, Representative. I think now we will turn to member discussion and questions. Representative Bakeford.
Just one quick question. Thank you for bringing the bill. Is there, and forgive me if I missed it, but is there a set amount of time that a school district has to provide this instruction? So is it embedded into the health class? Is it, an assembly? Is it embedded into advisory class? Like, how do you see this instruction happening?
Representative Hassan.
Madam Chair, Representative, I believe that it will be embedded in health class education.
And currently, if it's embedded in the current standards for health class, if there were statewide health standards, then it would be embedded in those standards. But the beginning date is the 26-27, that it's required.
Just one comment.
Representative Bickford.
So I think whenever we mandate new classes, so if a district isn't doing something now, it's going to, there's only so many hours in the day. So then whether it's an elective or another requirement is going to be taken away from students. So I think student or school districts should be doing mental health instruction, but just, and we've had different testifiers talk about the impact of mandating these things. It does impact elective options for students, so.
Representative Hassan, any comment?
Well, I believe this is important. If mental health wasn't important, if we didn't know that mental health was important, COVID hit and we realized that our students are suffering. I remember I was vice chair of ed policy during COVID, and the folks that were in ed policy with me remember this. We had educators crying in our Zoom, meetings, saying that we're overwhelmed, we're tired, we need help, and our students need help. So we really need to rethink the way that we think about mental health. And I think there's a whole lot of stigma and shame around mental health. That's why people don't talk about it. That's why people don't want a mental health diagnosis. But just like any physical ailment, mental illnesses are also another ailment, except it doesn't happen to our body, it happens to our mind. And if we teach our kids young age that it's okay when you feel depressed to go talk to somebody, it's okay. You can have sad days and good days and bad days. If that's the way that we're raising our kids and intertwining that with their education and embedding that in their life, they will know how to deal with stress when they grow up, instead of having a society that all depends on medication because we don't know how to deal with stress.
Representative Keeler?
Thank you, Chair. Thank you, Representative Lovett. I talked about it the last time. Addressing mental health is actually something we really need to do. Mine is more just a clarifying question. So in the last bill, when we talked about grades, we say like elementary, middle school, high school. And I know that that's been brought to my attention in some bills. In this bill, it says specifically grades 4 through 12. So I'm just wondering like how, not every school kind of has those same grade splits from elementary to middle school. I know like for 4th grade, 5th grade, that's still elementary for some schools. So it's more of just like a standardized question. When we do these requirements, do we break them down typically by grade like this, or do we typically break them down by like elementary, middle school, high school standards? Which I don't know if that's a question for you. I'm just seeing it show up in different ways, and I'm wondering how that plays out in our school systems.
Ms. Pryor?
Thank you, Madam Chair. Representative Keeler. I would say it varies so yes, so this has grades 4 through 12. I believe the CPR statute also has specific grades. In the standards, they are in bands. So for example, all the high school ones, I believe, are just like a block high school. So it varies both in the statutes that have specific requirements and in the standards.
Only made me more confused.
The current, like,
But I mean,
add on, the current statute, so 120B-21 does say currently, this is the way that it's written. I don't know who decided to divide these grades the way that they are, but if we need to maybe review it and say that this doesn't work for school districts, I mean, I'm open to the idea, but our current statute is written like this. That's what I'm.
Not in change in statutes in that part of it, just in the back, the date.
I understand.
Keeler.
Okay, thank you. That was when it was a suggestion, not a must. And so that's why I'm trying to like verify, like if we make this something that schools need to do, is it easier to implement in practice if the breakdown is middle school and high school versus that grade 4? That's the only thing I'm asking, and it's more just for implementation practical purposes moving forward with it. So that's
Interesting. A good point to raise, and something we should consider, and I will make a point of dealing with that. Representative Bennett.
Thank you, Madam Chair, and thank you, Representative Hassan. It is an important subject. I'm just curious if you have heard of something, and I'm not a psychologist or psychiatrist, I will just say that right up front. Had a little of education as a teacher in psychology, but there's something called the prevalence inflation hypothesis, and I just want to bring this out for you to look into as you're looking at this. The only reason I'm aware of it is I was looking into some mental health counseling and issues for a friend, and learned about this, that when we focus too much on mental health issues, there's a balance. There's increased awareness efforts, and then, but there, with that becomes improved recognition and overinterpretation. What happens is we focus on it so much, and especially with young people, that they start recognizing small mental health things that we all deal with daily, and hopefully we have fairly stable mental health brains here, but it overinflates these things and turns them into mental health problems. And I just would encourage you to look into that, because from my little understanding I have on this, there is a point where when we focus on mental health, it becomes actually counterproductive. And I heard that from a therapist who said, we only recommend this amount of time per week for therapy because an increasing amount of data is showing that it becomes counterproductive and makes things worse. So I'm just throwing that out there, not a criticism of your bill at all, but I will echo the, another mandate issue. There are so many important things. Mental health is one, no argument there. But honestly, Madam Chair, I think we're going to need to have a bill to increase the number of hours we have in the school day, because at some point, schools aren't going to have enough time, and maybe they're just going to need to have bunk beds there. And I'm being sarcastic here, but kind of serious too, and just keep the kids overnight, because at what point are we forcing so much on schools that there's no longer time to teach everything? And it's really hard. I remember that as a teacher, trying to cram things into the day. So I think we have very important subjects, but we have to figure out how that balance works. Thank you.
Closing comments, Representative Hassan.
Madam Chair and members, I'll say on the record, I am a mental health clinician. So I don't think, if you ask me, I don't think we focus mental health enough. And if we did focus mental health enough, we wouldn't have the problems that we have with our young people not understanding how to deal with simple stress and how to differentiate when they're, depressed versus when they're sad versus when they need clinically to be seen by somebody. Thank you for the lively discussion. I extremely believe that mental health is important, because you can learn all the math in the world that you want. If you're not emotionally healthy, that math and science and technology won't get you anywhere. So we gotta raise children who are emotionally, physically, and spiritually healthy. And if we're gonna do that, we need to increase mental health awareness. Health is one of the subjects that's, in our school curriculum, and focusing, a little bit and intertwining a little bit of mental health and saying that, hey, let's talk about depression, let's talk about, anxiety, let's talk about, want to seek services, want to talk to somebody, doesn't take away from math or science or technology or history or social studies. With that, Madam Chair, I know the bill is being laid over, and I'm open to suggestions on how to make it better. Thank you for your time, and thank you for the discussion. I hope you can support.
Thank you for being with us and bringing forward your bill. And with that, Representative Frazier renews his motion to lay over House File 4363 for further consideration and possible inclusion in a policy bill. Thank you, Representative Hassan, for being with us. All right, we move on, and we have Representative Huot and House File 4008. We just always like to have you back, Representative Huot.
Well, thank you, Madam Chair, and I apologize to the committee up front. This is a controversial bill. We'll be spending a lot of time on it today, so we'll move quickly through it, hopefully.
Right. So we have House File 4008, and it's our intention to re-refer this bill to the Education Finance Committee. That's because of, is that right? Am I on the right? That we're going to finance? There's a cost. There is a cost. So, yes, to re-refer it to the Education Finance Committee. And Representative Lee, can you motion House File 4008 before the committee to be re-referred?
That is my motion.
Thank you, Representative Lee. All right.
I think there's
We
an
have
amendment.
the bill before us, and we also have an A1 amendment. And it's just
Bring it in.
the A1 amendment, it sounds like,
It just brings in the athletic trainers that are really important.
okay, all right, thank you, Representative Huot. So if we can have a motion for the A1 amendment?
I move for adoption of the A1 amendment.
Thank you, Representative Lee. All right, discussion of the A1 amendment to get the bill in the shape the author would like it. Seeing no discussion, all in favor of the A1 amendment, please say aye. Aye. Opposed? All right. The A1 amendment is adopted. And please begin your presentation, Representative Hewitt.
Thank you, Madam Chair, and thank you, committee members. Real quickly, we'll go through this, that almost 500,000 people a year, almost 356,000 people a year have cardiac arrests outside a hospital. 90% of them are fatal. What this bill basically does is talk about our schools and what we want to do in our schools to change that. As an official, as an athletic official, and as somebody that hangs out a lot with the high school athletes, this is getting to be an ongoing problem. 23,000 children a year under the age of 18 experience cardiac arrest, and most 40% of them are athletic related. The SERP, which is a plan that we're presenting today that basically will require schools to come up with a cardiac response plan. Why we don't have these yet is surprising, because you go into a school and there is a plan for the fire extinguisher. I got a principal looking at me right now saying, yeah, there's a plan for everything. This is getting to be just as important as that fire extinguisher, and I think we got to move forward and come up with plans in our district, and this kind of lays that out for us. I'm going to turn it over to the testifier here real quick, and he can kind of go into it a little bit more in detail, if that's okay, Madam Chair.
All right. Thank you. If you could introduce yourself and begin with your testimony.
Thank you, Chair Pryor and members of the House Education Policy Committee. I'm Paul Wirt, State Government Relations Director for the American Heart Association here in Minnesota. I appreciate the opportunity to express the American Heart Association's support for House File 4008, legislation that will require school districts and charter schools to develop a cardiac emergency response plan. Sudden cardiac arrest is the leading cause of sudden death in young athletes and most commonly occurs during or just after physical exertion while engaged in practice sessions, organized competition, or other sports activities. With only seconds to react and every minute crucial, having an appropriate plan in place during a sudden cardiac emergency can make a difference in survival. The American Heart Association is working to turn bystanders into lifesavers so that in the time of cardiac emergency, anyone, anywhere is prepared and empowered to become a vital link in the chain of survival and provide CPR. That means ensuring that every school and athletic event and facility has a SERP plan in place and is working directly with local emergency service providers and others to integrate the SERP plan into the community's EMS responder protocols. The establishment of this plan will empower and train school personnel in providing life-saving care between the time when the victim collapses and emergency services arrive. Each minute following the sudden cardiac arrest, survival decreases. However, when treated with defibrillation within 3 to 5 minutes, survivor rates increase 50 to 70%. With thousands of students enrolled in Minnesota's public schools and charter school systems, plus thousands of numerous staff, it's important for school facilities to have a plan in place to address cardiac arrest. These plans not only benefit the students and staff, but the number of community members, parents, and supporters that come to school for events or other meetings. We want to thank Representative Hewitt for sponsoring this legislation. Thank you to the committee for hearing this bill. Chair Pryor, I would like to, if I can, ask my colleague, Mr. Dale Wakasugi, to kind of share his personal experience with this and support for the bill.
Thank you. Please settle in, introduce yourself again, and proceed with your testimony.
Good afternoon, Chair Pryor and members of the Minnesota House Education Policy Committee. I am Dale Wakasugi, a heart attack, cardiac arrest, and stroke survivor, resident of Woodbury, Minnesota, a community advocate on behalf of the American Association, and owner of my AED and CPR solutions. I'm pleased to be here today to offer my support for House File 4008, legislation that would require school districts and charter schools to create a cardiac emergency response plans. And I suffered a heart attack in 1986 when I was 36 years old. I was a very active non-drinker, non-smoker, and played college baseball. In 2007, while refereeing a high school basketball game at Fridley High School, I suffered a cardiac arrest. One of my heroes that day was Lindsay Paradise, an 11th grader who knew how to perform CPR and use an AED from learning about it in her health class just a few weeks prior to that evening. When cardiac arrest occurs outside of the hospital, survival more than doubles when people nearby act by dialing 911, starting CPR, and using publicly accessible AEDs compared to waiting for emergency responders to arrive. I support House File 4008 because we need to ensure that all schools have cardiac emergency response plans in place and practice, so anyone who suffers a cardiac arrest, whether it be a student, teacher, school administrator, or members of the community, can receive the life-saving treatment they need. So I want to thank Representative Huot for authoring this important legislation. And thank you, Chair Pryor and members of the committee for your consideration of this bill.
Thank you. Turn to member discussion. Representative Mueller.
Thank you, Chair. Thank you, Representative Hewitt. See you a lot in committee. So here we are. I love this bill. I think this bill is really important. As a person with a congenital heart defect, I know how important it is for us to have people who know what they're doing when a cardiac emergency happens. And it just so happened in Austin that we had a young man who actually died from a cardiac event because we didn't know, and it was right after football practice and all the things. And so I know this was something that I was noodling in my head and couldn't quite figure out what to do next and how to do it. And so love that you beat me to it, as this is something that I'd like to do. And so, you know, it's when we talk about putting things that are in place for our schools to be successful, this is one of those things. So thank you. And thank you for your support. And we're just so appreciative that you made it through all their things and you're able to be here to support the bill. Thank you so much.
Well, I think we should close with that, but Representative Hewitt.
I'm really sick of our colleagues across the table stealing my closings because they've done it a couple times this year, but
You're welcome.
Representative Mueller done a great job. I can't say much more than Representative Mueller did, and I do have to say to my colleague sitting next to me, and he is truly one of my colleagues, he was a referee, first thing I do when I go to a game to ref it is, where is the AED? I'm 58 years old. That thing could be used on me. So seriously, this is really important. I like that the committee heard it. I look forward to going over to Chair Yukim's division. So thank you, Chair.
Thank you. Any more comment?
I don't want to take, I'm not going to take away from that, but I'm just going to say I'm thankful that we have another 10%er here. You made the 10%. Mr. Withers here 4 years ago had a cardiac arrest, and he's with us today. So, but there are 90% that don't make it. So important. Thank you.
Thank you. Well, we feel that very much, this personal testimony. Thank you. Thank you for bringing the bill before us, and I now will take a vote.
You have to vote it out.
All right, and with that, Representative Lee renews her motion to re-refer House File 4008 as amended to the Education Finance Committee. All those in favor, please say aye. Aye. Opposed? Motion carries, and House File 4008 as amended is on its way to Education Finance. Thank you.
Madam Chair.
Thank you for being here. All right, we will now return to a bill that we started yesterday. That was just yesterday. And we heard some great testimony, but I think that we did not have time to really understand the bill. So that is House File 3372, Representative Clardy. If you can come down again, and we can begin with our questions and discussion. I guess what I need to do is bring House File 3372 before us again for discussion. And then it is intent, after discussion, to re-refer the bill to Education Finance will be the motion. And it was originally Representative Frazier's motion, so I think the bill is before us again. And I think that if Representative Clardy, if you could just give us maybe a couple bullet points of the highlights of the bill, we can start, members can bring us forward for discussion, the main elements of the bill that we heard testimony on yesterday.
All right. So what we're looking at is the EL students are the fastest growing geographical growing population. The things that we're looking at is to establish microcredentialing pathway for existing licensed teachers and administrators to grow their competency in serving EL students. We are also looking at EL students' additional support in the ALCs, because there's a lack there. And then also establishing a task force at MDE to inform the legislature of what resources would be needed to fully fund ELL learner programs in like the ELCs and what the best practices are.
Thank you for that summary. And I'm going to ask a question at this point. Can we, I guess I don't have a clear picture of what microcredentialing is, and I think that that's an important aspect of the bill, and perhaps if we can go on a discussion or a brief description of what that means and how this bill would advance that.
Madam Chair?
Yes, if
members
you
of
can
the committee?
identify yourself.
Yes, of course.
Proceed.
My name is Leotawa Dr. John Peterson, and I am the Senior Policy Fellow with the Minnesota Education Equity Partnership. Great to be back here with you all today. Microcredentialing takes different forms depending on the state. I think California was one of the first states to adopt microcredentialing. Essentially what it is it's providing licensed teachers in areas other than ESL with an opportunity to learn more about the best practices and promising practices for working with English learners. And so a case example would be the Southeast Service Cooperative in southeastern Minnesota received a federal grant about 1.5 years ago to provide for training for teachers who are not ESL teachers to do exactly that. Some of the best practices, promising practices, how to provide co-taught and co-planned instruction in ways that better serve English learners. And so that would be kind of just the nuts and bolts of the micro-credentialing piece. I will say it's not a proxy for a license, and we're not intending that it be a proxy for a license in any way. In terms of the bill language, the micro-credentialing actually goes two different directions. One, it provides for micro-credentialing for content area teachers in the area of ESL, but it also provides for micro-credentialing in the area for ESL teachers in content area courses. So like, for example, if I were an ESL teacher, I'd have an opportunity to earn a micro-credential in Broadfield Social Studies. The basis of that, and I'll wrap this up, is so that when we co-plan and co-teach together, maybe you're the social studies teacher and I'm the ESL teacher, we both speak the same language. I speak a little bit of Broadfield Social Studies, you speak a little bit of ESL, and we can better serve English learners and all students in the classroom.
And we are having a little discussion that we don't have the amendment in our packets right now. Yeah. Oh, it's not, yeah, and if we had it yesterday and then it was not put in again. If you saved it, you have it, and we can, so I think that the gist of it is we don't all have access to it. Chair, you.
Madam Chair, I think it is still posted too, but just
Still,
if
yeah.
people need.
So
paper
members, if you would like to look at the amendment, because the bill was amended, and so it is the bill as amended that we're discussing right now. And it's probably, there's not a new copy, or there was yesterday, but there's not a copy in the packet again today, but it is posted. if you have any specific questions, we can get access to it that way. So thank you. And thank you for the description of microcredentialing, and if I can follow up with that too, is it currently we do not have any microcredentialing, and so this would be a beginning of a new, or kind of a creation of a new kind of credentialing, I guess, is what we would describe, that does not currently exist. And I'm seeing a nodding of yes.
Madam Chair, members of the committee, yes, we do not have micro-credentialing as an option here in Minnesota. I want to stress that this would be a voluntary micro-credential. It is not a mandate. And so it would be an opportunity for teachers who are interested in participating in a program like Project Momentum to earn a micro-credential that would be then hopefully transcripted onto their license that identifies them as having, an additional 8, 9, 10, 12 credits in ESL or a broad field social studies or science or math area to be a more effective teacher in working with English learners.
Thank you. Are there member questions and discussions? Chair Youakim.
Thank you, Chair Pryor, and thank you for explaining the micro-credentialing. I'm very excited about that personally. Our son's getting a master's in literacy, and I was trying to get him to do a master's in EL, but it'd be something that is that option for teachers to go get that extra micro-credential so they can better serve their students. So thank you.
Representative Bennett. Okay. All right. Appreciate for this discussion that we've had on this bill. And with that, we will, we'll renew the motion to re-refer House File 3546 as amended to Education Finance. All in favor? It's 3372, excuse me. 3372, sorry. There's a lot of bills today. House File 3372 as amended to be re-referred to Education Finance. All in favor, please say aye. Aye. Opposed? All right. The ayes have it, and 3372 as amended is on its way to Education Finance. Thanks for returning today and continuing that clarification and discussion. We do appreciate that. All right. All right, so I think that we do have time to continue on and bring up again another bill that we started yesterday. If you give me a moment to reorientate myself. So it's House File 4611, and I'll have Representative Hill take over for 4611. And this was also amended.
I can show you what it is. Yes, I have this here.
If I could copy of the bill. Thanks.
Well, as you get settled, Chair Pryor, our next bill for consideration was also introduced with testimony yesterday. It is House File 4611. Members, it's our intention to discuss the bill before laying it over for further consideration or possible inclusion in a policy bill. Representative Pryor, Chair Pryor, can you please re-motion House File 4611 before us to lay it over for further consideration or possible inclusion in the policy bill?
So moved.
Wonderful. Would you like to help us revisit?
Thank you. All right, so House File 4611 was brought to us from the Metropolitan Library Service Agency, which is more commonly known as MELSA. People use that acronym. I have not heard of it before. But this organization is one of 12 regional library systems in Minnesota. And like other regional library systems, MELSA provides training, education, and programming for the metro library regions. However, unlike the other regional library systems, MELSA does not administer libraries. That responsibility is left to each metro county and their library directors. Because of this key difference, the executive leadership of the MELSA requires a different skill set. MELSA is currently working to hire a new executive director and is committed to recruiting a talented and diverse pool of candidates. However, the hiring requirements and state rules require that all regional library executives hold an MLS degree. As the MELSA director does not run libraries, MELSA requests to be exempted from this rule in order to attract a large and diverse pool of applicants to the position. So essentially, that's what we're asking, is the exemption of that master level in library science to be able to hold this position. And as members remember yesterday, there is opposition to it, so it is a bill that is under discussion right now. And we're trying to navigate, if it's something that should be included in a final policy bill or not. But I think it is part of this general discussion of whether or not, what's the appropriate level of education for any position, and if we should be dictating that in statute. And if this is a situation where, just as the governor at one point had said that positions that before had required a college degree, they realize now can be filled by people with associate degrees and other backgrounds experience, and that we no longer require college degrees for many jobs that we did in the past. Because also of the difference between being the executive position of this particular organization versus having a similar position at a county library, that masters of library science is not the same level of requirement and need as other skills are. So that was the idea of bringing this forward. Love to hear member comments and maybe not so much questions. I can get back with answers, but comments and perspectives on that.
Thank you, Chair Pryor. We'll open it up for discussion. Chair Youakim.
Thank you, Chair. Maybe just a question you can bring back to the stakeholders as you talk about this. I know that he had made some comments about a federal grant being able to come in unless there's a licensed librarian. Well, there are still at each of these MELSA libraries. The executive director just runs it as an umbrella organization. So that was confusing to me. Plus, I think folks have been asking for that specific notation to be pointed to in statute, and no one can seem to do that. So maybe just bring that back to MDE when you talk to them about, okay, you say it says this, but where would be nice.
Thank you, Chair Youakim. Response? Chair Pryor?
I think that's a really interesting question. I would be interested in the answer too. So I think that should be part of the ongoing discussion about the further consideration that we're taking this bill as.
Representative Bennett.
Thank you, Mr. Chair. And I did have a question, but I'll pose it as more of a thought to bring back. And I appreciate the ongoing discussion way that this is being handled to try to make sure that we get full understanding before it becomes law. But so my first thought when I saw this was, why would we be carving out one library system? Why not just the whole state? Because to me, a master's degree is either valuable for this or not, but it sounds like there are some intricacies I'm hearing that Rep. Youakim and maybe you had said too. So I'm just throwing that out. You don't even need to answer it, I guess, unless you know the answer as to what's different from this and why not just the whole state or not the whole state. I'm not going to argue. I don't know whether a master's degree is really important for this or not. So,
Right. So we thinking about that and processing it as, finding out that we as an education policy committee and education finance are responsible for libraries and we need to learn more about them. And I think that's an excellent thought of, and I think part of the discussion was along the lines that you're thinking now and that I was also thinking when the bill was first brought to me, is that what's the difference between this particular position within this particular organization, and that the master degree is not as essential to it's valuable, but is not as essential and not necessarily disqualifying, lack of, would not be disqualifying for this organization versus the other ways that other levels or organizations for library systems. So, and whether or not the master's degree. So I think that's the case that has to be made, is that in the further discussion that I will take back to the people that I'm talking with and working with to decide on this and the feasibility of it. So a very, very good avenue to pursue and to have completely clarified before we know that this is the right way forward.
Any follow-up, Lead Bennett? No. And Representative Lee, did you have a question? I thought we saw a signal there.
Yeah, I guess question and maybe also thoughts on bringing things back. I did also want to just add color to this, that the language here is permissive, and so, folks with master's degrees can still apply, but the way I understand it is we also have a workforce shortage amongst librarians, and so understand the need for, skilled librarians to get people the information they need, but a lot of people have also been exiting the library profession, which is not great, and so I understand why in this piece, and I also don't want to confuse folks, because this position is, I think, my understanding, a little bit more clerical and administrative and not directly serving libraries. So don't want to confuse folks about that. But I think part of what's driving this is probably also just this workforce issue.
Thank you. Thank you for that comment.
Thank you. Closing comments, Chair Pryor.
Nope, but this is still a work, you can tell by the bill number, 4611, that it's a new bill that's been introduced, and there's definitely some work that needs to be done on further clarification before deciding whether or not this is something that we should be putting forward as statute.
Thank you. And with that, Chair Pryor renews her motion to lay over House File 4611 for further consideration. And with the first half of our agenda complete, we're going to go into recess. We'll reconvene here at 6 o'clock.